Hi, I'm Rosemary Clay, the Executive Director for the Bergen Newbridge Medical Center Foundation, New Jersey's largest not for profit hospital, and the sponsor of In the Know It Row, an informative conversation with leading clinicians on important health topics. Today I'm joined by Adrienne Mariano, Senior Director of Behavioral Health Services here at Bergen Newbridge Medical Center. Adrienne has been in the mental health field since 2005. She graduated from Montclair State University in 2005 with a major in psychology and a minor in criminal justice. Her passion has always been to help others and to provide an empathetic ear to those who need to be heard. Most recently, Adrienne has focused on the significant shift in heightened social media usage and ownership of smartphones, which has led to psychological changes in children and teens. Eating disorders and the impact of social media, the consistent use of ads, videos, pictures by celebrities, social media influencers appears to have caused an increase in body image problems. With the increased time spent viewing various videos, social media posts, children and teens have become accustomed to seeing ideal images of male and female bodies and may not realize how much these pictures might be altered. Thus, some may attempt to adjust their own bodies to match the images through the use of dieting, excessive exercise. However, these efforts may balloon into eating disorders or manifest into other mental health issues such as low self esteem, low self confidence, depression, or anxiety. Thank you for joining us, Adrienne. So nice to see you again.
Thank you so much for having me. I'm really excited about our talk. I have a lot of great information for you guys, jam packed with a lot of information and statistics with studies. A lot of studies have been put out there examining eating disorders, but also the impact on social media and media use on our bodies and our body image. So, this is an important topic.
Absolutely, absolutely. So let's start off with an important question with what type of eating disorders are prevalent and what are the risk factors?
So there are numerous types of eating disorders, and not everybody fits neatly into these categories. So it's important to know that just because we talk about certain ones doesn't mean that this is a label for someone. People struggle with different types of symptoms. So some of the most common ones, and they're in the DSM, which is the manual that physicians, doctors, psychiatrists, and clinicians use to study eating disorders and learn how to treat them. So anorexia nervosa, that's one of the most common ones, and a lot of people know about that already. So that's just characterized by weight loss, difficulties maintaining appropriate body weight, and a distorted body image. So it doesn't matter how skinny you get, they want to be skinnier, and that's just their image of themselves. And that's pretty sad to live with that. The next one would be bulimia nervosa. So that is characterized by a cycle of binging and then some compensatory behaviors. So like self-induced vomiting to compensate for the effects of the binge eating. So you're trying to compensate for the overeating by throwing up. The next one, this is a new addition to the DSM. So that's binge eating disorder. That is recurrent episodes of eating a large amount of food at one point. So to the point of discomfort. And then feeling also, which is important, feeling a loss of control during this binge, experiencing a lot of shame, guilt, and distress afterwards. But they're not using that compensatory measure like purging. So that's what makes it a little bit different. And this is actually the most common eating disorder in the United States. Two other ones that I'm going to talk about, they're not in the DSM, but their awareness is on the rise. So orthorexia, so that's something new that people are studying. And that's basically an obsession with proper or healthful eating. And, a lot of people are now in the know about eating well and exercising, but this is taking it to another level. This is not healthy. So you might be going to different events and you're bringing your own food or you're restricting a lot. This is just with the idea that I need to be healthful. So I'm going to take this to the next level. They actually damage their own well-being, whether that be physically or emotionally. So that's something to keep in mind. And then diabulimia, those are individuals that are dealing with diabetes. So they are restricting their insulin intake based on the thought that the insulin is related to weight gain. And so you can see how that is potentially going to be affecting their physical health in a very negative way if you're restricting your intake. So those are kind of the definitions of some things that we're going to be talking about to give you some groundwork, some foundation for what we're talking about. Now, some risk factors. There's no one confirmed risk factor for someone who is going to develop an eating disorder or maintaining an eating disorder. So traditionally, young white females are thought to have the most prevalence in studies. That's actually not a fact. We're going to get into that. It affects anybody across gender, sexual orientation, socioeconomic status. The most important findings in the studies were that negative body image, sociocultural idealization of thinness, so that thought that you have to be thin to be liked or to succeed in this world, is something that promotes an eating disorder. Also, low self-esteem that you mentioned before, and social media use contribute to eating disorders and disordered eating. Some other risk factors can include parents that have eating disorders or disordered eating and have weight biases. So they can't really distinguish if that is genetic or not, but there's a high, it's not just genetic, and be environmental as well. Some other populations that are at risk. So people that are part of the LGBTQ community, transgender individuals experience eating disorders at a significantly higher rate than cisgender individuals. Also, gay men. Compared to other populations, gay men actually only are part of the 5% of the population. But when you look at people that identify as gay, 42% of those people actually consider themselves having an eating disorder or struggling with disordered eating. So that is a high percentage of just a little part of the population. But one thing to note is that someone who is part of the gay community and feels connected to that community actually serves as a protective factor for them. So that's really important too. Those struggling with substance use, with eating disorders, you can see a lot of things that are co-occurring. So they might have substance use, eating disorders, and a mental health diagnosis on top of it. So a lot of that kind of commingles with each other. So according to the National Center on Addiction and Substance Use, up to 50% of individuals with eating disorder abuse alcohol or illicit drugs 5 times higher than the general population. That's a lot. And then the substances that are most frequently abused by people that have eating disorders include caffeine, tobacco, alcohol, laxatives, diuretics, amphetamines, heroin, and cocaine. And you can kind of see that those particular substances, they're known for keeping weight off or facilitating losing weight. So it's not just something that people choose. You know, as marijuana, you're going to have an increase in eating. So that's not something that's really found that people are using. One thing that I just wanted to mention, I'm into fashion. I love fashion. That's something that I've been into for a long time. But if people remember back in the 90s when people, music was kind of grungy and there was a certain type of look that people had, they had something called heroin chic. And that was something that was promoted in media, in magazines. Like, they're not going to have social media like in the 90s, but magazines and certain ads promoted this heroin chic look, which is basically an emaciated type of look. And you just have to think about what that actually means and how detrimental that was for people growing up in that time period. So eating disorders and substance use actually share a number of common risk factors. So brain chemistry can be a factor, family history, low self-esteem, depression, anxiety. Also, people with trauma or PTSD are highly affected and can have some risk factors as well. A lot of evidence suggests that bulimia and binge eating disorder has higher rates of trauma and PTSD. So it can range from anywhere from 38 to 44% of those people in that group. That's really high as well.
It is.
And when you think about substances and trauma and PTSD and the eating disorders, using substances can be a way to self-medicate for whatever is going on. Binge eating and purging appear behaviors that facilitate reducing that hyperarousal state that you get when you're kind of having flashbacks and things like that, or anxiety associated with that trauma. So like numbing and avoidance and forgetting those traumatic experiences is going to be really important. And that's going to be their way to control what they're feeling, is by the food.
Mm-hmm.
Also, athletes, you have to think about. Certain sports emphasize an ideal thinness or certain physical characteristics. So, like when you think about bodybuilding, they're on a strict diet to look a
Mm-hmm.
certain way. Gymnastics, you're restricting a lot, and a lot of the females, they may lose their periods because of what they're not eating, because they're just so intense in the training. And wrestling, you're trying to have a physical physique for that. And then finally, like the middle age group. So if you are a middle-aged person and have been struggling with eating disorders most of your life, you can feel really isolated in treatment or seeking help, because most of the treatment is targeted towards young women. So that's something to really think about. And just overall, just because you're looking at someone, you can't tell if they have an eating disorder. People
Mm-hmm.
think like it's just that person who's really emaciated. It's not just that. A lot of people are at a normal or a heavier body weight and they're struggling. So you can't just label people. It's really important to note that.
So, just to bounce off of that, so what are some of the warning signs, or the symptoms that you should notice from a loved one or a family member?
Yeah, that's a really good question. So you can see warning signs, emotional and behaviorally, but also physically. So some emotional and behavioral symptoms, you can see there's a preoccupation with weight, food, calories, maybe even carbohydrates, fat grams, dieting, all those kind of buzzwords. But also there's a refusal to eat certain foods, and then it might even progress to restricting whole categories of food, like I'm not going to eat carbs ever, or I'm not going to eat sugar. And with a balanced diet, you have to incorporate everything in moderation. They can appear uncomfortable eating around other people. You can see them withdraw from friends and family and have some extreme mood swings. And that could be, taken into account by like the lack of nutrition and healthy eating. And then physically, you can notice the fluctuations in weight. Also, a lot of people may have stomach cramps or gastrointestinal issues because they might be vomiting. You might have menstrual irregularities for people that are identify as female. Difficulty concentrating because you're not getting the correct food intake and nutrients. You can see people faint, have sleep problems, feeling cold all the time. Some people that binge or purge, they might have cuts or calluses across the top of their fingers because they're using their fingers to purge. Also, people that are purging, you might see the swelling around your salivary glands, and also like behind the ears, will see it swell up because of the vomiting. And then some people might get fine hair on the body. Like if you've ever seen a newborn baby, they have that really fine hair. That's what you might see with people that are really in a bad way. When you see that, something's very wrong. They need help.
Okay. So, what is some types of treatments that's available to someone that might be struggling with eating disorders?
Absolutely. So there's different levels of care available for eating disorders, and I'm going to go through them from the least restrictive to the most restrictive. So least restrictive would be like an intensive outpatient or an outpatient program. And that's usually held like a few times a week. And that's to provide support and coping skills to patients. They're medically stable, so they're not at risk of being hospitalized for any medical issues that may come up with this. They don't need the daily monitoring. They're psychiatrically stable as well. And they have some symptoms that are manageable, but they're still focused on recovery. The next one is going to be the partial hospital program. They can be going several times a week as well to the program, usually typically around 5 days. The patient's medically stable, but the eating disorder you can still is impairing some functioning, but there's no imminent risk of like hospitalization or a medical issue that needs to be addressed. You might see some binge eating, some fasting, or limiting of the food intake. So this program is really focused on providing the skills and providing support while managing any relapses in recovery that might occur. And then there's residential. So they're medically stable, but there's psychiatric impairment where partial or an intensive outpatient program won't be appropriate or safe. And then lastly, inpatient. So the patient's medically unstable, so they might be seeing unstable vital signs or medical complication that's coming from the eating disorder. They most likely also will have a psychiatric illness that is unstable, so evidenced by worsening symptoms or maybe even suicidal thoughts or attempts.
Wow. Okay. So, what's the difference between an inpatient and outpatient treatment for eating disorders?
So inpatient and residential treatment, that's essential for stabilizing patients medically and psychiatrically. This is an environment, again, to address any emergent needs that surface with individuals with eating disorders. And then partial or the intensive outpatient treatment that I mentioned, that's usually a step down program from an inpatient or residential setting. That's providing the structure to learn new coping skills to manage an eating disorder in a supportive environment. Um, they're providing the tools to help manage any of the relapses while they're in the community. A lot of the times, they also bring in the family or anybody who's supportive of the patient in recovery to teach them too, to provide support to them and helping them manage eating. It's a whole new way of teaching people how to eat and manage their eating disorder.
So, with that, what are some of the complications associated with eating disorders?
I'm going to go through a whole list because it's not just one part that's going to be affected. It's going to be your whole body, your
Right.
mind, everything. So I'm going to go through different parts of this. The cardiovascular system is also going to be affected. So consuming fewer calories means the body breaks down its own tissue to maintain the working body that's going on. So the muscles are the first organs broken down, and the most important muscle in the body is the heart. So pulse and blood pressure can drop. The risk of heart failure is going to rise as the heart and the blood pressure gets lower. Purging and vomiting or using any laxatives depletes your body of electrolytes, which are super important for maintaining your body. Electrolyte imbalances, they can lead to irregular heartbeats, they can lead to heart failure, and even death. So that is really important stuff going on there. Gastrointestinal, being able to have bowel movements due to lack of nutrition in the body or using laxative can make a person actually dependent on the laxative because you're damaging nerve endings. So even if the eating disorder is regulated and they're in recovery, you're still going to have that impact later on and throughout your life because you've damaged that part of your body. Binge eating can also cause the stomach to rupture, causing life-threatening emergency. That's a really huge problem with people that are binge eating. They're not getting that sensation in the brain where it's time to stop eating. They're not getting that fullness because they're in that moment. They're being very triggered. And vomiting over a long period of time can make the salivary glands appear swollen, like we mentioned before, under the jaw and in front of the ears. And then neurological, so dieting or self-starvation, that prevents the brain from getting nutrients it needs to lead to obsessing about food and difficulties concentrating. So as you're going through your issues as an eating disorder, you're obsessing about the food anyway, but neurologically you're causing that cycle to repeat because of the lack of nutrients, because that's what you're focusing on, because your body's trying to get food but you're restricting it or you're purging or something like that. Severe dehydration is also a problem, and the electrolyte imbalance can lead to seizures and muscle cramps. And if the brain and the blood vessels can't push enough blood to the brain, that can cause fainting and dizziness. And then we move on to the endocrine system. So that's also affected. And without enough fat, many of the body's hormones begin to fall, including estrogen and testosterone. So that is going to cause the menstruation to stop in women. But that also affects men with the testosterone as well. Low sex hormones can cause osteoporosis and cause bone fractures. So that's also affected. And without enough food, the body temperature can drop and that can cause hypothermia. So a lot of people that are dealing with eating disorders, they mention that they're very cold or they have numbness in their hands and feet because of that. And then mortality is a huge issue as well. So people with anorexia, they had a 6-fold increase in mortality compared to the general population. And reasons for death, they include starvation, substance use, and even suicide. There was a study that found that mortality rates for anorexia was about 4%, bulimia was 5.2%, and eating disorder, not otherwise specified, would also be 3.9%. So you can see that the eating disorder can affect you actually living because all of these different parts of your body are affected. And then that also can lead to the depression and anxiety that come along with what's going on with your eating disorder. It's not always just the eating disorder. You're going to have psychiatric components as well. So it can cause people to feel suicidal and very depressed. So it's important for us to know the warning signs and know how to help.
So, what are some of the resources that are out there to help?
The best place to find help, if you log on to your computer and you go onto the National Eating Disorder website or NEDA, they have a wealth of information. So they have a search engine to find clinicians in your area or programs in your area that deal specifically with eating disorders. They even have templates for people to use with their insurance companies in case they're denied treatment. And that sometimes happens, which is very unfortunate because this is a fragile population that desperately needs help. Insurance companies will deny patients because they feel like they're not engaging in treatment or they're stable, but they're going to need continued support. So they have a lot of templates on how to fight that, which is excellent. And that's a great resource for anyone.
And so, the social media impact on eating disorders, explain that to us. How does that impact it?
Oh, the impact in social media is really major. So according to the Nielsen Company, this is one of the studies that was done. It's a US-based global marketing and research firm that tracks media use and habits worldwide. So it's not just talking about the United States. But the average American spends more than 11 hours a day on social media. So that's more than sleeping or actually working. You're spending a majority of your time looking at social media and receiving those messages. And then everybody knows Dove, the soap and all of that stuff. They've actually done a study as well. And if you see their marketing and their ads, they actually are really body inclusive. So they did a study and they had researched 10,500 women and children in 13 countries and found that beauty and appearance anxiety continue to be a critical global issue. So the media is a huge driving factor in this study. So out of this, about 7 in 10 women and girls report a decline in body confidence and an increase in beauty and appearance anxiety, which is they say that it's directly driven by the pressure to perfection from media and advertising unrealistic standard of beauty. And almost 8 in 10 girls, which is about 79%, and even more women, which is 85%, admit to opting out of important events when they feel bad about their body image. So people are not going to certain events because they feel insecure because of these messages that they're receiving. So say you have a wedding that you want to go to, that person with an eating disorder might not feel comfortable enough to even go, which perpetuates this cycle. 9 out of 10 women actually say they won't even eat, putting their health at risk if they feel insecure about their body. And then to counteract these unreal messages, a majority of women and girls around the globe, they're challenging social media to portray a more diverse physical appearance, with age, race, body shapes, and that's really important. Also, in another study on social media, nearly all the girls that they had interviewed, which is 95%, say that they see the onslaught of negative beauty critiques on social media posts, comments, photos, videos, and a majority see them at least once a week, which was 72%, and wish that social media was a space that empowered body positivity, and that was 62% of those people. 41% of teen girls say that they use social media to make themselves look cooler. So just think about that. What are our teens thinking about when they see these messages, and what would they do to feel cool on social media? So you can see when, you can log on to anything and you can see unrealistic and digitally altered bodies. That's really important. Another study had found that social media use is linked to self-objectification, and using social media for merely 30 minutes a day can change the way you view your own body. And for men and young men, pressure from mass media to be muscular also appears to be related to body dissatisfaction among young men. This effect is going to be smaller than women, but it's really a significant amount of people. And then when I mentioned the National Eating Disorders Association, or NEDA, they developed the Body Project, which is a really great program that they developed. They target college women and also girls in school to basically challenge that thin ideal portrayed by media. So it's effectively shown to reduce body dissatisfaction and negative mood in regards to social media use and body types. So you can actually log on and look into this. And if you feel like this is something that you need to have in your school, around your community, they will help you develop programs for that. So that's really great. And, during my research for this particular podcast, which I was super excited to do, I found some tips for media self-care. And that's really important, not just for anyone who is dealing with an eating disorder, but just in general, because you are constantly receiving an onslaught of negative images, posting, comments, and you need to be able to manage that, especially when, I mentioned before, some people are spending 11 hours a day on social media. Like, this is important for people to know. So choosing your media mindfully, and we say mindfully a lot within our system, and as a clinician, but what does mindfully mean? So that's really being selective about what media you're choosing to look at, choosing media that actually supports your values and building self-esteem and body confidence. That's something really important. A super simple one: limiting your screen time and social networking. So the more that you're exposed to these body images and these comments, the more vulnerable you are to thinking that this is your identity, or this is something that you have to conform to. And that's super important. When you're looking at these messages or these posts, test the message for body positivity. So what is it that you're seeing? Is it a digitally altered person? Is it something that's realistic or not? And what is that message that they're trying to send to you? So every ad and every post, there's going to be a meaning behind it. What is it that they're trying to tell you? Are they trying to tell you that you have to be thin to be liked? That's something that you don't want to engage in. Talking back to media, so refusing and boycotting certain companies that don't promote a body image that is healthy, that's important. Taking a stand is really important in advocating for this, and also advocating for positive body talk. So seek out businesses and realtors that incorporate this as a value that you share is going to be really important.
Adrienne, I have one more. I have a quick question as we wrap up. We're on the end of our segment, but Krista Rose has a question, and it says, "As a parent, what are some ways to educate your child on social media and body image?"
That's really great. So we need to start when our children are young. So educating our boys and girls about what it is to be healthy. So I'm going to go through a list of things that you can do with your children and educating them. Education is really important to change the view that you have on your body. So first, starting with the parents, examining your own thoughts and beliefs and behaviors and prejudices about food, and replacing the unhealthy attitudes with positive ones. So taking an inventory of yourself is going to be the first step to understand what your biases are. Another way to support your loved one in recovery, or even teaching your children, helping them develop and modeling a positive body image. That's going to be very important. Setting a positive example also of a healthy and balanced relationship with food. So don't talk or behave as if you're constantly dieting or you're commenting about your body. That's going to send the message to your children that a healthy body image is something that's going on for you. So discussing with your sons and daughters the dangers of trying to alter your body shape through dieting or restricting. Helping your children accept and enjoy their bodies and encouraging physical activity is going to be important. So convey to your children that weight and appearance are not the most critical aspects of a person. It's not your self-worth. It's not your identity. And, we always talk about with our children the dangers of prejudices and racism and things like that. So that's really important. But also there's prejudices against people that are overweight. Linking that is going to be very important. Your body image is not your defining factor in who you are, and that's the underlying notion that people have that have eating disorders, like, because I'm overweight, I'm unlikable, I'm unlovable. That's something that we want to erase from our vocabulary when we're teaching our children things. Building self-esteem is going to be really important. Talking to your children and doing that in an open and honest way, really listening to them is going to be something that is impactful. Encourage critical thinking, encouraging them to pay attention to media and what these messages are and how to challenge them, because we can teach our children to be stronger than these messages by, listening to them, educating them. Developing with them a system on internal values. So not just saying, I'm unlovable because I'm overweight. Like, what are your other personality factors? Are you a caring person? Do you want to help people? What are the other internal factors that are going on for you? And then talking to them about having a good relationship with food, educating them on what's a healthy diet and what's not. And then also, we talked about the warning signs and risk factors of an eating disorder. Being educated on those things and teaching your children about that is going to be really important as well.
This is a chock full of information, and I hope people have an opportunity to rewatch this segment because it's really great information. And we're hoping that there's in our works of programming for eating disorders here at Bergen Newbridge Medical Center, and I'm hoping that you will support us here at the foundation. And I look forward to our next segment together. Thank you so much, Adrienne.
Thank you so much.
Take care.
Bye.